Unfortunately, multiple myeloma is a disease that has a lot of disparities. I think we have a lot of work to do. While myeloma is not the most common cancer, it only affects, less than 2% of all. It makes up only less than 2% of all cancers here. It does disproportionately impact the Black community. So Black patients are 2 to 3 times more likely to be diagnosed with myeloma than other racial and ethnic groups. And this is due to the higher risk of developing MGUS, which is a precursor to multiple myeloma. We also see a higher association of sort of a positive family history in the Black population. And I think reasons for the high risk of development of MGUS in this population probably isn't fully understood, but there are many factors at play, inclusive of social determinants of health. So, and particularly even obesity. So, obesity has been linked as a risk factor for the development of myeloma. And non-Latinx Black adults have the highest obesity prevalence at about almost 50% compared to other racial and ethnic groups in this country. And what causes obesity? I can tell you in this particular population, the Black population, I can tell you many things. So structural racism plays a role. So structural racism limits access to healthy food, which is essential. It can cause food deserts in certain areas where there's a high BIPOC population. Residential segregation plays a role. It concentrates Black people in specific neighborhoods, and those neighborhoods could have fewer resources, which includes access to good education and healthcare. And then, of course, racial bias, whether it be conscious or unconscious. It can impact the relationship between, the Black population and healthcare in a negative way. In fact, there was a study that looked at racial inequities in access to stem cell transplant and myeloma. And if you adjusted for income and you adjusted for education, the access to transplant persisted. The inequities in access to transplant persisted, which suggests there's some sort of clinician bias in the decision to pursue transplant or not. And in terms of presenting illness, we know that Black patients with myeloma tend to be about 4 to 5 years younger than other groups. They present with more anemia, they present with more kidney disease at diagnosis, which makes itself more caring for the patient more complex. And this level of disease burden obviously impacts diagnosis. And we also know that there's a delayed timing of diagnosis for Black patients. There's a delayed timing of starting their first therapy. That in itself causes more complications, has patients with more disease burden. We know that there's higher emergency department visits among Black patients with myeloma. And when we look at sort of novel and emerging therapies, there was a study that I published last year that I presented as a poster presentation at ASH, which is the American Society for Hematology. We demonstrated that lower receipt of stem cell transplant, CAR T cell therapy, and participation in clinical trials was found among Black and Latinx patients at relapse. And we also found that this statistic of lower receipt of these therapies were also happening to patients of lower socioeconomic status. So all these type of inequities, they impact morbidity, they impact mortality, but there's a lot of studies that show if you provide that standard of care treatment in an equal access system, these inequities in delay of diagnosis, treatment, access to care, particularly mortality, are essentially erased. Meaning, if you treat Black patients on time with efficacious therapy, their survival is equal, if not better, than other racial and ethnic groups. Personally, the work that I do, so aside from providing direct patient care, I also advocate for myeloma patients nationwide. So I'm a member of the Nurse Leadership Board of the International Myeloma Foundation, where I work on our Empower initiative, which is where we partner with cities across the country to improve both the short and long-term outcomes of Black patients with myeloma. This particular diversity initiative is designed to empower healthcare professionals, community leaders, neighborhoods, families to essentially break down those barriers by raising myeloma awareness. And at my work at Flatiron, I'm a clinician lead in our health equity research lab, where we strive to improve health inequities we see in access to care. So our research has demonstrated racial inequities in treatment initiation, survival, and even access to telemedicine during the height of the COVID-19 pandemic. And we're working on broadening eligibility criteria and diversity in clinical trials to improve access for all patients. So I guess the question is, what can APPs do to help improve some of these disparities we see, particularly in myeloma? So APPs can strive to practice in areas that are underserved, right, where there might be a shortage of clinicians. That includes telemedicine or telehealth. That can provide access to patients where high quality care is not necessarily accessible. And becoming not just culturally competent, but also practicing cultural humility, which is learning and understanding your specific patient's culture, what their social needs are. That's how you really foster trust and a good relationship with your patient. APPs can advocate for policy changes. They can do community outreach efforts, specifically participating in lots of different nonprofit organizations that have great work on the community level. To better yourself as a clinician as a whole, I say every clinician should undergo implicit bias training so you can understand your own unconscious biases, what they are. And you should screen for social determinants of health for every patient that walks in your door. That way you can understand what risk factors are present, which could complicate the care for the patient, and then collaborate with different social services to see what resources are available for the patient in need, whether that be transportation, whether that be financial, safety, whatever. And participate in research, right? Health equity research. We also provide, we can provide more insight and build evidence-based practice solutions to address the gaps that we see in historically marginalized populations by conducting research and publishing on it, and becoming educated on clinical trials and educating your patients on clinical trials. Clinical trials should be thought of at every decision point in a patient's treatment journey, not just reserved when standard of care options are limited. So bridging the learning gap with the patient on clinical trials, explain the clinical significance and the importance of trials to patients is another thing that APPs can do to sort of decrease some of the disparities that we see.